It's David at PTC Physical Therapy and Smart Moves PT Consulting. I am going to share my screen, and I wanted to shoot this quick video because there's a call to action or a public comment period for at the state of Rhode Island Department of Health and the State House regarding the current vaping epidemic and crisis. So I received this, I've been a longtime member of the Health and Wellness Committee as a volunteer in the school district here in Cumberland. Been following this very closely regarding this growing epidemic of vaping. And now the state is finally calling for some official rule changes that would ban flavored e-cigarettes, kind of following in line with what Massachusetts has already attempted to do. So in case I can't get there, this is actually I'm posting this on Monday on my lunch break, and it's actually the call for public comment is January 7th. So that's actually tomorrow evening. So here's my take on this. And there was a great report that was put out recently by the American Heart Association, Stroke Association, kind of tracing the dollars. They called it Broken Promises to Our Children, a state-by-state look at the 1998 tobacco settlement and what happened to all that money for public health education to maybe would have offset some of the current crisis they're in. I'll touch upon the pain points that we've had at our own town level trying to combat this. But let's look at the report, and because we can get a quick look at state by state where the money actually went or didn't go. So this is a great report done by the Tobacco Free Kids organization. So you can pull this report up by every state, but I was very curious, especially with this upcoming hearing, what was being done in Rhode Island. And you can see the scope of the problem. You can see over the last several years, there really hasn't been any increase in spending, despite the epidemic and the dramatic rise in vaping and the crisis now that we're in. If you look at what the CDC, so my interpretation of this report is that the state of Rhode Island got 196 million, almost 197 million dollars. The CDC recommended they spend $12.8 million on that. And I don't know the breakdown where that money actually went. Maybe that's the big question to ask at the State House. But of that total amount this past year, they only spent $394,000, whereas Big Tobacco spent $26.5 million right here in Rhode Island. So if you're looking at trends in prevention, we've actually spent a lot less over the last 12 plus years. This is all publicly available. It's just you have to go look for it. And this is what impacts me the most as a practicing physical therapist, and why I'm actively involved through some initiatives to try to change this. You can see the costs, annual costs here in Rhode Island, estimated $640 million, attributed to cancer. I'm looking at cardiovascular risk, in particular stroke risk, with a higher incidence of younger stroke, and related to a project I'm working at the University of Rhode Island with the I-Corps and MIT Ventures program. But per household, it hits hard. And again, keep coming back to how much Big Tobacco is spending. So when we go into the weeds and try to figure out how we're going to combat this, we haven't spent any time educating or any dollars educating our youth about the magnitude of this problem. And, I made some efforts that I want to kind of call into here. I started by, I was quite disgusted, quite frankly, at the fact that most of our town health and wellness committees actually have no budgeted monies directly attributed towards health and prevention. We all, by state mandate, have to have formal committees with meetings, but most of our initiatives are handcuffed by lack of dollars. And a while back, I wrote this grant for our town of Cumberland, and this was back in 2016. And we saw that there was a problem back then. We tried to basically do everything free that we could get our hands on. I called the attention of the committee to a Catch My Breath program by CVS Health, for example. The Rhode Island Department of Health had a program called or may still have, the Tobacco Control Program. And that was supposed to um, earmark money or require individual vape shops that were selling these untested and unregulated products, in my opinion, and we knew they were selling them to younger population. They sprouted out on the block that I work alone in my town. When this became popular, there were 7 facilities right on the main road where I treat, and I've run into young patients that come into clinic and can't even finish their PT appointment because they have to step out and take a hit. They're so addicted to this crap. So that's a real life example. But this project actually did not get funded, and it was too bad because now 3 years later, we don't have a plan to address the epidemic in terms of these kids are already addicted, and now we need to develop digital tools and formal programs to actually hopefully offset some of the lifelong chronic diseases they're going to encounter. So, unfortunately, the problem stems from not addressing the real issue that is at hand here, and it's putting resources into primary prevention and education, and giving schools the power to change the way they teach this stuff and dedicate time instead of training for the test, or kids don't have a fundamental understanding about how their bodies work and the real risks here. So my only hope here is that if someone listens to this and sees that, maybe chase the dollars back and give some of that money back, because $200 million is a lot of money to only spend 300,000 on prevention. So that's all for now. That's my 2 cents. And if you want to reach out to me, I'll provide a link to this. And I think I'm going to do a full formal webinar on this to really chase the dollars down as soon as I can find the time to do that. So that's all for now. Again, this is David at Smart Moose PT. Thanks for watching.